One of the unsettling aspects of Holmes's crime and I guess his pathway to violence is that, he was quite an unremarkable individual. And so, as we said, not psychopathic, not antisocial. He had a reasonably positive childhood. From what we understand, a generally good relationship with his parents. But despite sort of that reasonable uh, upbringing and involved in education, a lot of pro-social and protective factors were evident in his life. He did progress to carrying out really such an atrocity, and that's really hard, I find, to reconcile and to try and make sense of, because we can explain it in some ways from the clinical perspective, but what differentiates, one offender from, say, another offender that has a similar presentation? I guess where I'm going with the question really is there anything that really stood out that you think led him down towards carrying out such a horrific act of violence compared to other individuals that may have similar presentations and struggles?
There are, my guess is, millions in the world, hundreds of thousands in the US, that have relatively similar backgrounds and never do this. And that's the mystery. That's the mystery for understanding. That's the mystery for preventing. That's the mystery for recognizing before the tragedy or atrocity happens. In his case, things were building up over probably years, at least many, many months, probably years since, give or take, mid-adolescence. But nobody knew about it. He didn't talk about it with anyone for a long, long time. That brings us to when we see this kind of behavior or even these kinds of fantasies or thoughts in people as clinicians or as observers, do they always predict violence? The answer, as you just said, is absolutely not. Such fantasies are not unusual, particularly in young children. They're not unusual at all. And so we can't just lock everybody away when they haven't, quote, done anything. That makes it awfully hard to deal with. And it's part of living in a civilized society.